The single factor that is most correlated with the outcomes of these injuries is the time from injury. The clock actually starts the day of the injury. Believe it or not, at the molecular level, things begin happening right at the nerve injury. And the nerves actually lose power not just out towards the fingertips, but going back towards the brain. And studies have shown that the spinal cord is changed even within hours of the injury.
And it's usually within 6 to 9 months where you want to intervene, and often you won't know at that point how much recovery you will actually get, and that's where the electrodiagnostics help predict that. We still can offer other options down the road if it's later, and there are patients who have a greater ability to recover neurologically. So we want to see the patients further down the road, but the later you get, the less you can do and less options exist.
These injuries can be a mild stretch that might recover on its own, to a devastating injury where all 5 of the nerve roots have been torn from the cervical spine, from the neck. So diagnosis is critical, and that is the first thing that needs to be diagnosed. Is this a partial injury that's going to get better, or is this a severe injury that has no chance of getting better? Because if it's the latter, we need to move rapidly towards surgical reconstruction. If it's the former, we can buy some time. And unfortunately, all too often, we find out that patients and their doctors really don't understand what's available to them. And they may be told, don't worry, just wait, this will get better, we've seen this before, your injury will get better, it just takes time. And weeks go by and things haven't happened, and don't worry, it'll get better. That process, unfortunately, and particularly if they change care providers, can multiply. And suddenly you're 3 months, 6 months, 9 months into the injury and nothing's been done, and the nerves haven't gotten any better.
But I think that's one of the major problems, is that it's often felt that nothing can be done. And a lot of the newer procedures that are being done, the surgical reconstructions, are not done at a lot of places, and there's probably not enough medical and public awareness that these are available. And so these patients just sort of accept that as their situation and their fate.
We would advise our patients out there, you are your own best advocate. You need to go to the web, research, read what you can. There's actually plenty of information on the web. And if you're not getting the questions that you have answered appropriately, or if you just want to know more, get a second opinion. That's the key to getting better, is early diagnosis and treatment.